As we age, many seniors experience a gradual decline in bodily functions. One common yet often underappreciated health issue is anemia. Although not typically life-threatening, anemia can significantly impact quality of life by causing chronic fatigue, reduced concentration, and a weakened ability to fight off infections. The symptoms are often subtle, which means many older adults miss early diagnosis and treatment, ultimately affecting their daily activities. Understanding the causes, types, prevention methods, and treatment options for anemia is therefore essential for maintaining health and vitality in later years. Basic concepts and mechanisms of anemia. 1. What is anemia? Anemia is a condition characterized by a drop in hemoglobin levels below normal ranges, resulting in inadequate oxygen delivery to bodily tissues. Medically, anemia is defined as having a hemoglobin level below 120 grams/L in men and below 110 grams/L in women. A reduced hematocrit, the percentage of red blood cells in the blood, is another hallmark of this condition. Since hemoglobin is critical for oxygen transportation, its insufficiency leads to decreased cell metabolism, along with symptoms such as generalized weakness and fatigue. 2. Major causes of anemia. There are several factors that lead to anemia in older adults. The most common causes include inadequate nutritional intake. With age, appetite often decreases and digestive absorption becomes less efficient, which may result in a long-term deficit of essential nutrients such as iron, vitamin B12, and folate. A monotonous or overly bland diet further reduces the raw materials necessary for healthy blood cell production. Chronic occult blood loss, conditions like gastrointestinal ulcers, hemorrhoids, or other internal bleeding issues may cause a steady, unnoticed loss of blood. Over time, this diminishes the body's iron stores, leading to iron deficiency anemia. Decline in bone marrow function. The blood-forming capacity of bone marrow naturally diminishes with age, and chronic conditions can exacerbate this decline. Insufficient production of red blood cells becomes a significant factor in the development of anemia. Immune or genetic factors, inherited blood disorders, such as thalassemia, or immune-mediated red blood cell destruction, hemolytic anemia, can emerge in later years, causing chronic reductions in hemoglobin levels. Chronic diseases, diseases such as chronic kidney disease, autoimmune disorders, and certain cancers can impair the bone marrow's ability to produce red blood cells, either directly or through promoting continual cell loss. Analysis of common types of anemia. Depending on the underlying cause, the most common types of anemia in older adults include iron deficiency anemia, typically resulting from a lack of iron in the body. This form of anemia produces small, pale red blood cells. Inadequate dietary intake or poor iron absorption are frequent culprits. Megaloblastic anemia, this type is caused by a severe deficiency of vitamin B12 or folate, resulting in abnormally large red blood cells that do not function properly. It is often associated with chronic gastrointestinal issues or medication-induced malabsorption. Hemolytic anemia, characterized by the premature breakdown of red blood cells. Hemolytic anemia can occur even when the bone marrow compensates by ramping up production. It is commonly seen in autoimmune disorders. Aplastic anemia, in this severe form, the overall blood-forming ability of the bone marrow declines, causing a reduction in all types of blood cells. Management typically requires specialized medical care. Blood loss anemia, this occurs when significant blood is lost due to trauma or internal bleeding. Both acute heavy bleeding and chronic low-level blood loss can result in a sudden drop in hemoglobin levels. Comprehensive strategies for preventing anemia. Prevention is the cornerstone of managing anemia. The following strategies can help seniors maintain healthy blood levels. 1. Maintain a balanced diet to ensure adequate nutrient intake. Diversify your meals, aim to include a wide variety of foods in every meal. Incorporate lean red meats, fish, poultry, and eggs along with a robust selection of green vegetables, legumes, and fruits. For example, red meat and liver are excellent sources of bioavailable iron, while citrus fruits and kiwi provide plentiful vitamin C to enhance iron absorption. Pair foods strategically. Effective nutrient absorption often requires combining the right foods. When consuming iron-rich foods, pair them with vitamin C-rich items. Simultaneously, avoid drinking beverages like strong tea or coffee during meals, as they contain compounds that inhibit iron absorption. Rotate your menu, changing your meal plan on a weekly basis by adding seafood, lean meats, nuts, and vegetables of various colors can help ensure a balanced nutrient intake and prevent the pitfalls of a monotonous diet. 2. Supplement nutrients responsibly. For seniors who are unable to meet their nutritional needs through food alone, supplementation, such as iron supplements, vitamin B12, and folate, under the supervision of a healthcare provider is crucial. Proper dosage and administration are important to avoid potential gastrointestinal discomfort or other side effects. 3. Undergo regular health checkups and monitoring. Routine blood tests, ideally at least once a year, are important for monitoring red blood cell counts and hemoglobin levels. Seniors with chronic conditions or who are taking long-term medications may require more frequent evaluations. Early detection of abnormalities allows for prompt and targeted intervention. 4. Improve lifestyle habits. Engage in moderate exercise. Gentle exercises, such as walking, tai chi, and light yoga, not only improve cardiovascular health but also enhance digestion and nutrient absorption. Additionally, regular physical activity helps reduce stress, improves sleep quality, and creates a conducive environment for the production of healthy red blood cells. Develop a consistent sleep routine. Adequate sleep is essential for restoring energy and maintaining hormonal balance. Irregular sleep patterns can disrupt digestive processes and hinder nutrient absorption, ultimately impacting blood health. 5. Manage underlying health conditions. Chronic diseases, such as kidney conditions or gastrointestinal disorders, should be managed in close collaboration with your healthcare provider. Since these conditions can affect blood cell production and survival, a comprehensive approach to managing overall health is necessary. Personalized treatment options for anemia. When anemia is diagnosed, a tailored treatment plan is necessary to achieve long-term improvement. Common treatment options include: 1. Medication therapy. Oral iron supplements. For iron deficiency anemia, prescribed iron supplements, such as ferrous sulfate or ferrous fumarate, are the first line of treatment. Supplementation should be taken as directed and, ideally, alongside a source of vitamin C to boost absorption. Vitamin B12 and folate supplementation. Patients with megaloblastic anemia often benefit from either oral or injectable forms of vitamin B12 and folate. These supplements help stimulate the production of properly functioning red blood cells. Erythropoietin injections. In cases where chronic kidney disease or bone marrow depletion is a factor, doctors might recommend injections of erythropoietin, EPO, to encourage red blood cell production. 2. Surgical and interventional procedures. If anemia results from localized issues, such as gastrointestinal bleeding or tumors, interventional procedures like endoscopy or surgery may be necessary to address the source of blood loss and restore proper blood levels. 3. Transfusion therapy. For patients with severe anemia who are experiencing significant symptoms, blood transfusions can provide a rapid increase in hemoglobin levels. However, transfusions are considered a short-term solution, and underlying causes must be treated to ensure lasting improvement. 4. Comprehensive rehabilitation. Along with medication and surgical interventions, lifestyle modifications are critical. A balanced diet, moderate exercise, and adequate rest help support the natural recovery of the body's blood-forming functions, ensuring sustained health improvements. 5. Caution against unregulated products. The market is rife with products claiming to quickly boost blood levels. Often, These supplements are not supported by scientific evidence and may even contain harmful ingredients. Seniors should always consult with a healthcare provider or nutritionist before adopting any such supplement and should only choose products from reputable, certified sources. Real-life cases and lessons learned. Case 1, John's dietary overhaul. John, a 74-year-old gentleman, relied on a simple diet dominated by plain noodles and rice porridge, neglecting sufficient intake of proteins and leafy greens. During a routine checkup, his hemoglobin level was found to be only 88 grams/L, a clear indication of iron deficiency anemia. With encouragement from his family, John restructured his diet by adding lean meats, liver, and dark green vegetables to every meal. Under his doctor's guidance, he also began taking prescribed iron supplements. Within 3 months, John experienced a noticeable boost in energy and endurance. Everyday activities like walking became much more manageable. Case 2, Susan's holistic adjustment. Susan, a 68-year-old woman, suffered from diminished digestive function due to long-term use of stomach medications. A routine blood test revealed that her hemoglobin levels were below normal, and she began noticing occasional memory lapses. Diagnosed with megaloblastic anemia caused by vitamin B12 and folate deficiencies, Susan followed her doctor's advice by continuing her required medications while supplementing her diet with vitamin B12 and folate. Working closely with a nutritionist, she diversified her meals with a variety of vitamin-rich fruits and vegetables. Over several months, Susan found that her energy levels improved significantly, and her mental clarity and daily functionality were enhanced. Case 3, Robert's comprehensive recovery. Robert, a 65-year-old man, initially ignored subtle signs of anemia until his hemoglobin levels plummeted during a medical examination. It was then discovered that chronic gastrointestinal blood loss was the underlying cause, which had progressively worsened due to untreated internal bleeding. After thorough testing, his healthcare team developed a personalized treatment plan. An endoscopic procedure identified and addressed the bleeding source, and Robert was subsequently placed on an iron supplementation regimen. Coupled with a gentle exercise program, his blood parameters gradually stabilized, leading to a marked improvement in his overall quality of life. While anemia might not be immediately life-threatening, its effects on the quality of life in seniors are significant. Through proper dietary modifications, responsible nutrient supplementation, regular health monitoring, and personalized treatment strategies, most older adults can reduce anemia's symptoms and regain their vitality. Maintaining healthy blood not only supports the optimal function of vital organs but also provides the energy and confidence needed for an active, fulfilling lifestyle in later years. Each positive change in managing your health is an investment in a better future. Seniors are encouraged to regularly monitor their blood health, maintain open communication with their healthcare providers, and educate themselves about nutrition and wellness. With a science-based approach and targeted treatments, you can successfully combat anemia and enjoy a vibrant, balanced, and independent life. Important reminder: every medication and nutritional supplement should be used strictly under the guidance of a qualified healthcare provider. Avoid unregulated products and always consult a professional for safe and effective treatment options. Important reminder: